Thanks so much, David. Much appreciated. Next, we're going to hear from Senator Sam Bell.
When our son was born, he had to spend a month in the NICU. And while we were there watching him ventilated and worried about what his future would be, worried whether he would survive, what else were we doing but calling the insurance company? Because that's the experience of being sick in America, of having a sick loved one in America, is that on top of everything else, on top of your fear, on top of the illness, you have to spend hours and hours and hours fighting with your insurance company. And sometimes you lose. And when you lose, the consequences can be catastrophic for millions and millions of Americans. So many Americans, so many Rhode Islanders died because of our broken healthcare system. So many Americans, so many Rhode Islanders are traumatized because of our broken healthcare system. And yes, we can fix this. So many other countries have gotten this right. America can do this too, and we can begin this right here in Rhode Island. And yes, it is feasible. We can do this at the state level. This is a complicated endeavor, but an incredibly important one. Very few things that we do can so meaningfully improve the lives of the people of our state. This is an urgent moral necessity. The costs of not taking action, of allowing our broken system to continue, are too high to contemplate. We cannot let this broken system of for-profit insurance companies siphoning off money, traumatizing people, denying care, and leading to death and injury all across our state. The costs are too high to bear. We cannot allow that to continue. And this legislation provides for a transition period. It's a big transition, but there will be immediate benefits, because one of the first steps that we must take is to bring Medicaid up to a Medicare standard of care. A lot of the costs are in the fact that our Medicaid reimbursement rates are so much lower than the Medicare reimbursement rates. You talk to any providers in our state, those low rates are one of the biggest drivers limiting their ability to deliver the high quality of care that they want to deliver. So that is the first issue we take on. And once we have brought that Medicaid rate, that Medicaid standard of care up to the Medicare standard of care, we're ready to begin the transition process and move the entire market into a system that is free at the point of service, where you don't have to spend hours and hours and hours fighting with your insurance company, worried you might lose. You won't have to deal with that. And that is the vision that we have for Rhode Island. And yes, I know the insurance companies will fight this tooth and nail, because it means the end of their business model, the end of their ability to make so much money off of human suffering. But difficult fights are worth taking on when there is so much to gain and there's so much suffering that we can put an end to. So I'm very excited. Thank you all so much for coming out here to support this important legislation. Thank you all to everyone who helped us craft this bill. Thank you all to everyone who's going to work so hard to help Representative Rollins and I get this legislation passed in the next few years. Thank you so much.